Welcome to the Cannabis Equipment News Podcast.
Hi, I'm David Manti, and welcome to a new episode of the Cannabis Equipment News Podcast. With me today is Dr. Mike McCormick, VP of Strategy at FloralWorks. Thank you very much for joining me today.
Thanks for having me, David.
Yes, our second attempt after the brush with the fire in our office building. So, sorry, thank you very much for coming back, man.
Sure thing, no problem. Glad to see you guys down over there.
Yeah, you know, the longer you're in this space, you realize, like, we need to move because we're getting all the signs, you know? Like, a weekly siren is a good idea that you should get out of the building. But before we get started, please make sure to like, share, and subscribe to the podcast. You can also help us out a lot by leaving the podcast a positive review on whatever platform you use. If you want to email the podcast, you can reach me at David@Cannabis Equipment News with email the podcast in the subject line. You can also subscribe to our daily newsletter. Make sure you get it delivered to your inbox first. Well, Mike, I always like to start with a little bit of background. So how was it that you came to cannabis?
Good question. For me, it's a bit of a complicated story that involves, personal interest, research, and even my interaction with the world of technology law. And so I can start by saying I've been interested in cannabis on a personal level my entire adult life, and even down to the science of it. And I am a scientist by training. And that sort of leads me to how I got started in cannabis science. So I obtained undergraduate degrees in chemistry and biochemistry from the University of Michigan. And following that, I went straight to MIT, where I did a PhD in chemistry. And after that is actually where I got my start in cannabis research, which was when, upon completing my PhD, I moved out here to San Diego, where I am now, to take a postdoctoral position with the Scripps Research Institute, which is where I ended up working on the cannabinoid receptors, CB1 and CB2 specifically, and studying the structure and function of those receptors. And this was way back in 2008 through 2014, approximately, was when I was doing that work. So some time ago in terms of the scheme of cannabis science these days. But yeah, so that was where I got my start in cannabis research and working on the actual receptors. After that, after completing that postdoc, I moved in sort of back into the world of, I guess, pharma chemistry, where I took positions, two positions in particular, back in Boston, working for patent law firms, where I was helping attorneys obtain patents on pharmaceutical drugs and processes relating to those drugs. After doing that for a while and realizing that I needed to be back in cannabis, I jumped ship on the law firm world, moved back to California, and started doing consulting in cannabis. And that was now about 7 years ago. And in this capacity as a consultant, I was applying my skills as a chemist and having this background of studying the receptors, as well as the most recent at the time background that I had developed in patent law. And so applying all three of these things to help particularly startup companies in cannabis, as well as research groups do technology transfer, which is what ultimately led me to FloralWorks, which is where I am now.
When you were coming out of school, were you pursuing a career or research in cannabis? Like, did you know that's what you wanted to get into, or was that, just a random job posting that you found?
Yeah, it was actually kind of serendipity. So when I took my postdoc at Scripps, I went there to work for a specific professor and on a project working on an X-ray light source. So completely unrelated, but the funding and some of the backing for that project kind of fell apart due to the fact that people in La Jolla, California, didn't want to put a X-ray device that was capable of generating high energy radiation in their backyard. And so fortunately, the lab that I was working in was sort of a mega lab that involved multiple professors. And since I had become an expert in a field called crystallography, which is the determination of protein structures at an atomic level as a graduate student, it was easy for me to move into a project that was available in that lab, which was GPCR structural characterization. And CB1 and CB2 are GPCRs. It's a specific type of receptor that's found in your body and brain. a class of receptors. And so since I had established this scientific background as a crystallographer, there was a need for me to work on the crystallography and structural characterization of CB1 and CB2. So although I had been interested in cannabis and cannabis science and psychedelics on sort of a side level, it sort of just fell in my lap here in San Diego that this project happened to need someone to work on one of these GPCR proteins, and the one that happened to get assigned to me was CB1. And so it was serendipitous.
So when you're working on CB1, was there an aha moment or any time where you're working on this project and it kind of opened your eyes to the true potential of the cannabis plant?
Absolutely. So the Scripps Research Institute, among schools that do research and academic research, is more tied in with industry than a lot of other organizations. And so as such, we at Scripps, I had access to a lot of pharmaceutical companies around the world who were developing compounds that were targeting CB1 and CB2. And again, this is way back in 2010 is the time frame that I'm talking about now. And there were people out there, designing synthetic cannabinoids. And this is, again, the same reason that people work on synthetic cannabinoids today was the case back then, which is that it's hard to touch THC and anything that comes from the plant. It was even more difficult back then, so much red tape. And so people would go out and synthesize new molecules because those new molecules are not illegal. They're not phytocannabinoids. They don't have the stigma associated with them. There's a different kind of stigma, I guess. But so what amazed me at the time was for one, learning a lot about the function of these type of receptors and how they can be tuned and their activity can be sort of dialed in. And that furthermore, that people were actually doing this. And back then, the interest in the cannabinoid receptors and designing drugs towards them was in the area of obesity. And so if we think about cannabis being something that stimulates your appetite, and this is, of course, very useful for people in certain therapeutic conditions, like when they're unable to eat because of some disease state. It's possible using a receptor and a well-designed drug to push that effect in the other direction. So instead of having a drug that stimulates your appetite, you could have a drug that destroys your appetite or significantly reduces it. And so this was early on in the world of cannabinoid receptor targeted drug design, an interest back then that, okay, well, we can create an anti-obesity drug using the cannabinoid receptors. And that's sort of a possible aim, and that's something that was attractive at the time. But to me, what I learned from that is like, wow, there are a lot of things that you can treat via the cannabinoid receptors potentially, and they range from all the things that we are familiar with when it comes to cannabis: pain, appetite, mood. But not only that you can affect those things, but that you could push them in one direction or another. And so that even way back then, I started brainstorming on the ideas of being able to design a drug that had all of the beneficial features of THC, but none of the downsides. And that's still something that I'm working towards today. It's a huge ask, but it is possible. And so that was really, I guess, my aha moment then.
Did the anti-obesity or the appetite suppressant drug ever come to fruition?
So good question. So there were a number of compounds in development back then that didn't ultimately make it to the market. And that's because, like many drugs that are in development, they fail at some point in the clinical trials. And part of the problem, I think, that the reason for that is because the effort there was to sort of shut down the receptor. So rather than to turn it up or turn it one direction or another, it was just to shut it down. And so the problem with that is that cannabinoid receptors, in the absence of any cannabis, are doing a lot of things in your body. They're maintaining your mood, and they're helping with certain types of low-level pain and all kinds of things. And so when you shut that down, you may be able to affect something like appetite, but you also affect a lot of other things. And so that sort of rudimentary kind of design is not ideal. And we realize that now, and it took that kind of work. However, the fact that those compounds were able to shut down the receptor and bind so tightly, for example, and not be displaced by other compounds, these features of those early drug design became research compounds. And so if I want to specifically shut down the receptor, now I go and buy from a chemical supplier one of those failed drugs and use it in a laboratory setting and for a variety of needs. And so yes, that's sort of the history. Those would-be drugs ended up becoming research tools.
Well, that's really interesting. Is that how you jumped into the pharmaceutical side, and how did you get involved with patent law?
Yeah. Okay. So as a postdoc, which I very much enjoyed the science that I was working on, I was years out of my PhD and thought by then I should be rolling in cash because I was still in my 20s back then and had different perspectives on the world. But I wasn't, because I was a postdoc, and postdocs are not compensated particularly well. And so the real drive out of research and into patent law was money for me. I was just tired of being a poor academic, and law firms were offering me boatloads of cash to help them with their patent procurement. And so that was what sort of drove me into patent law. And it's really kind of an interesting transition once again in terms of the serendipity, because I had spent at that time years studying the cannabinoid receptors and G protein coupled receptors, which that type of protein in your body, it accounts for about 40% of all pharmaceutical drugs and over-the-counter compounds. So if you go to get something from your doctor, or you go to CVS and buy something, there's a 40% chance that compound is going to interact with a GPCR. And so this sort of intimate knowledge and understanding of GPCRs that I had developed at Scripps via studying the cannabinoid receptors was hot to apply in the world of patent law, because people who are designing drugs are designing them to target this kind of receptor. And so I ended up working on a lot of clients, even some that even when I was as a patent practitioner, working on a lot of clients that sort of stemmed from laboratories that I had worked with as a researcher. And so there was a nice, easy connection there, but the real drive out of academia was cash.
Well, and so you said that you needed to get back to cannabis. Was it because you wanted to get back into the industry, or was it just that all the boats are full of cash? You're like, all right, let's do something I love now.
No, absolutely not. So after years had rolled by working in patent law, which I learned a ton of stuff. It's an intense job. If you think of if you know anybody who's a lawyer at a big law firm, it's basically the same kind of deal. Huge billable hour requirements, tons of time spent solitary writing in front of a computer, which I learned a lot from, but I always considered myself more of the client-facing type. And so the money wasn't enough to keep me in it. But what I was able to take with me, the portable part of all of that work, was an underlying knowledge of how big pharma protects their inventions and their drugs, and how they do that. The details of how that's handled. And of course, all of this work as a early career patent practitioner is assisted by attorneys who have lots of experience, and that's still how I operate today when I do patent law in cannabis. But to me, I was excited by the fact that, hey, I now have this whole tool set that's not only cannabis science, but now patent law in my pocket. And that if I could, that then seeing new opportunities in cannabis and new opportunities to consult and even potentially find jobs, allowed me to sort of more easily move out of patent law and say, all right, I'm done doing this. This isn't totally for me. I got out of, the poverty state that I felt that I was in as an academic. And I was ready to take all of these tools and not thinking about the cash anymore, and just being focused on what I wanted to achieve at that point allowed me to sort of refocus my efforts, move back to California and get into cannabis and start consulting using all of this knowledge that I had amassed.
So looking at where pharmaceutical patents are right now, what is the landscape for cannabis patents?
Great question. It's something I spend a lot of time steeping in these days, and a lot of clients that I've had in the past are interested in that exact question. And I'll tell you the short answer. First of all, I could go on for another 2 podcasts on that one.
It's great. It's a series. No.
Yeah, exactly. But I'll tell you that the short answer is this. There is opportunity out there for cannabis companies and anybody doing cannabis science to obtain patent coverage on their technology. There's plenty of opportunity for that. A lot of people don't do it. And the reason they don't do it is because it costs a ton of money and it takes a long time. And I think you even sort of hinted at, and I'm sure you've experienced through your time in cannabis, that there's a lot of effort on let's get paid tomorrow or let's get paid today, even for what's coming out. And there's not necessarily a long enough lens by a lot of those working in the upper echelons of cannabis, from my experience, that are willing to sink the time and money into patent prosecution that needs to be done to get patents. So the opportunities are there. There are not a lot of people actually pursuing them. And so although you may hear buzz here and there around this company or that company filing a patent or something like that, it's different than actually aggressively pursuing them. And so there are opportunities. Not a lot of people are pursuing them. Those that do realize that it is very expensive and time consuming. The one thing I want to add to that is that because cannabis is a natural thing, there are lots of elements of it that you have no chance of ever patenting. And so that is one of the reasons that the drug industry, the pharmaceutical drug industry, is not as interested in cannabis as we are, for example. But because there is sort of a reduced patentability on things that come from nature.
So it's not about patenting the plant. Is it about the process into how you use what you take from the plant?
Yes. So in terms of like what types of patents do people get in the world of cannabis science is it sounds like what you're asking.
Yes. That's much more succinct and understandable. Yes. No.
Yes. I mean, this stuff is so complicated. So patenting the plant, no one can do that. No one can do that. If something exists in nature and is known, it's out of the realm of patents. Now that's a broad statement, and there are ways sort of to, I guess, work around that, or work about that are entirely legal. And so for example, it is possible to get a plant patent. There's a specific type. Patents fall into multiple categories. There's utility, provisional, design. Plants is one of them. And it's historically something that people don't pursue patents on. Pharmaceutical companies have no interest. People that generally work with plants don't do this. So for a lot of reasons, the plant division at the patent office is not very busy. However, of recent times, there's been interest in cannabis. And that's the reason is because it's easy to get a plant patent relative to others. Okay. But the thing about it is that you have to do certain things to prove that in preparation to get a plant patent. You have to asexually reproduce it. You have to actually send a sample of the plant to the patent office. So only until just recently, like for example, DC's cannabis laws changing, could you legally send a cannabis plant to the USPTO. And so these are some of the things that one could do around a plant. And I would like to note here that if you are working in plant genetics, cannabis plant genetics, or you are a grower who does extensive work on your strains, you should consider the possibility of certain types of plant patents. I know everyone's thinking trade secrets, and we can get into that at some point as a way to protect your things. But if you have awesome genetics, it's worth something considering. That's the plant. Now, most of the patents that I work on are on molecules or on ways of making them or uses for them. Okay. So for example, let's say that I extract a minor cannabinoid from a cannabis plant. Okay. That minor cannabinoid exists in nature and is known in science. Typically, you can find some paper going back even 100 years to where some chemist has identified that phytocannabinoid. So getting a what's called a composition of matter patent, which is the sort of holy grail in the patent world, on that compound is impossible. There are certain extremely rare situations where one might be able to get a patent on such a thing, and that would involve purifying that compound to a completely unnatural level, for example, and then covering that extremely purified state, for example. That would be one possible way that someone could get a composition of matter patent on a phytocannabinoid, but it's probably not ever going to happen. What people do get patents on is uses for them. So let's say that I, again, purify some minor cannabinoid from a cannabis plant, and then I work with an academic institution that studies some disease, and that I run trials using this purified cannabinoid with those academic institutions and determine that it has some sort of effect on a disease state or some indicator for a disease state. Then suddenly I have a use for this cannabinoid that's never been established before. Okay. And so as such, I can go to the patent office and say, here, I have this compound. Yes, it's naturally occurring. I'm not trying to cover the patent on that. I'm more trying to get a patent on the use of this compound to treat disease X. That is where the patent space is happening a lot in cannabis and psychedelics as well. So natural compounds with new uses or first established uses. Okay. And so that has to come from data. It can't come from anecdotal information like, say, oh, everybody knows cannabis is good for sleep. That's not enough information for the patent office to give you a patent on cannabis for sleep. You actually have to go and run some experiments that would connect it. And so hopefully that answers what you were asking for.
No, it does answer my question. So is cost the only deterrent? And have you seen companies out there that could have been protected by a patents that have otherwise been, the victim of some, like, essentially trade theft?
Yes, it happens. There's also a lot of times, because there are certain things in cannabis that a lot of people are doing and they're similar to one another. For example, extraction is just an example. There's variations between extraction, but more or less it's kind of the same regardless of which lab you're doing it in, especially if you're talking about the same type of technique like CO2 or ethanol or something like that. So yes, there is some crossover, and I do think a lot of people worry about having their stuff stolen. And what I see more often is that people want to rush into sales of things. Okay. So somebody has developed a technique to extract or to do this, that, or the other thing with cannabis. Okay. And then they want to start selling it. They want to make money off of it right away. But there is something called an on sale bar in the world of patent protection, which says that if you start selling something that you've invented, and there's lots of definitions for invented in this case, but that you've invented, it doesn't necessarily have to be a trinket or a device or something like that. It could be an extracted product, for example. If you start selling something that you've invented and a year's time rolls by, the patent office is not going to let you patent that anymore. They say that you've given this out to the public to the point that you waited too long, basically. And so there's a period of time where you can lose things that way. The same thing goes with talking about things on a public and any sort of public platform. Okay, so if I put something in a website or on a podcast, and then a year's time rolls by before I go to pursue a patent on that thing, I will lose my opportunity to get coverage. So people do lose those kind of opportunities. That's why I'd say if you have something that you think is any sort of invention, and a lot of people are wrong when they think they have an invention, I'll just give that disclaimer. But it's important to not sell it yet, and not even offer for sale. So it's like you can't say, "Oh, I'm going to go behind and say, hey, does this company want to buy this technology?" You can't do that. You have to go ahead and pursue patent protection on it first. And so yeah.
Is it you say a lot of people are wrong when they think they've invented something? Is that because they don't know that somebody else has already invented it? Like, is it just straight ignorance, or is it because it's like unpatentable?
Yes. So both of those things. First of all, a lot of people aren't aware that other things are already out there, especially in the scientific literature. Because a lot of times what's happening in science is in research labs, particularly at universities, is like 10 plus years ahead of whatever's happening in business or commerce. And so a lot of people think they have something, but it's like, oh, if you do a literature search, I found your thing. And so that doesn't necessarily mean that someone couldn't get a patent on it. There are artful ways of carving around what's already known out there. But yeah, that does happen.
What are these artful ways?
Yeah. So because patent law is really the intersection of technology and the law, technology is of course science, but it's also business, and it's based on things that you can measure and feel and stuff like that. Whereas the legal industry and law in general is what I would describe compared to science as mushy, in that fact that you can mold these things around as you please, and that's how lawyers do their thing and make lots of money and help people where they need help. And so what I'm saying is that it's possible to say, for example, let's say that I've come up with a compound that's a new derivative of a cannabinoid, and that somebody else out there working on a completely different type of drug, say at a pharmaceutical company, has synthesized a bunch of compounds And when they go to protect those compounds in terms of patents, they're going to cover those individual compounds, but a lot of related ones that they know they could make. And the patent office will allow you to do this. So it kind of says, look, I've made A, B, and C, and this is a well example that I can also make D, E, F, and G. And they'll get you patent coverage for A through G. Okay, even though I haven't made some of those compounds. And so this gets extreme to the point where you have patents that cover thousands, hundreds, and even thousands of compounds, where the company has only made, say, a few dozen. And so it's possible that your compound that you just came up with, or that you synthesized, or that you found a new use for, is actually covered by someone else's cloud of coverage over a bunch of compounds. So in a way, I shouldn't be able to get a patent because somebody already has it. But I can show the patent office that, hey, they were actually studying their drugs for use as lubricants, and this is a cancer med. And that thing, they actually only made 8 of those compounds, and this falls into this sort of category of things that they didn't actually make but thought they could, and aren't actually studying this. And if you go look at this company, they're not selling this compound. So in a way, 2 people could have patents on the same kind of thing, which is not supposed to happen. But in cases like that, if your attorneys and the technical folks that you have working on your patent applications and your patent prosecution are knowledgeable enough and resourceful enough, can find ways to get things past the patent office that others couldn't.
Okay. Because when you're talking about it being mushy, I guess my basic understanding of patents was that it just needed to be like X percentage different in order to get a patent on it. Is that applicable or true?
Usually, yeah. So for example, especially if you're talking about a formulation, like this, formulations are pretty straightforward. Let's say I've got 10% THCV, 80% CBD, and 10% THC. That's a formulation, and if I was able to get a patent on it, which somebody might be able to get that, then if somebody had percentages that were just outside those ranges and tried to get a patent on that, they probably could. Okay. The difference is where the issue of obviousness comes in. Okay. And so this is something that the patent office considers. There's the straight numbers like you were talking about, where it's like, oh, well, this is different by measurements than this other thing, and so therefore I should get a patent. The patent office will also look at that and will be like, they made this concoction, so the idea of changing these percentages a slight bit to make your thing is obvious. Any scientist or formulation scientist would look at this thing and say, hey, I can make this too. And so therefore, that's not an invention. And so that kind of goes back to what we were talking about earlier. It's like invention requires multiple components, and it's not just coming up with something new. It also has to be new and non-obvious from what's out there.
Okay. What are your thoughts on the potential for therapeutic use for cannabis?
The sky's the limit.
Yeah.
and so there are so many things. I mean, I truly believe in cannabis and the medicinal power of it. I experience it myself in many ways, and we all know the anecdotes. I mean, how many people know that somebody sleeps better on cannabis, or somebody is less anxious, or somebody can get their job done on cannabis, or that's just the way they need to unwind? There's a zillion things, and that's just getting into like the sort of feels that one gets from recreational cannabis. The therapeutic world, the sky is the limit. Okay, I mean, there are hundreds of compounds in cannabis plants that could be potential medicines. Okay, and we know this, and there are some examples out there. We have Sativex and Epidiolex as actual pharmaceutical drugs that are just THC and or CBD in ratio, and so that's the 2 most abundant cannabinoids, and they already is curing childhood epilepsy. And so there are so many things that one could extract, but the way to get there is it's fun to be excited about that, but there's a lot of work that has to be done between now and actually getting that medicinal value out of the cannabis plant from a pharmaceutical and supplement and individual compound perspective. Of course, people can treat various things. Sometimes I treat my grumpiness with a specific cannabis strain that works really well for that. But that kind of broad thing is not going to work for the FDA and for the regulatory bodies that want to understand these things once taken all apart. And so as such, the way to access that all the medicinal value of cannabis is to go through and pull out individual compounds and study them and study their toxicology and determine uses for them, and work with academic groups that are willing to study those and run the cellular assays and mouse trials and eventually clinical trials with people. although there's flaws in that whole system and gaping ones, we still have to work within it if we want to actually get the cannabis plant and all of the cannabinoids out to people in a way that's accessible and safe and reliable. And there's tremendous potential, but there's so much to be done between now and then.
What strain do you turn to for your grumpiness?
Uh, Somebody gave it to me. It's called K2. I think these days it came down from Humboldt and not from a dispensary. And I'll tell you, they've been coding the names of their strains out there now, and I respect that because it's exactly what I do with the names of cannabinoids when I share the information. Is they become coded numbers because this, I mean, it's kind of like what we've been talking about today is protecting the inventions of people, and that's really what I care about, and really what I focus on as a practitioner in the patent space, is because I mean I want the scientist or the grower, or the formulation technician to get their dues when somebody comes up with one of these things, because eventually pharma, big ag, big business is going to run with all of this. And so the time is now to get the patents in the hands of the people who actually did the work. And so that is a driving factor for me, and actually a route to getting done the things that one needs to do to commercialize cannabinoids and to turn them into drugs that everyone can access and that you could go and buy over the counter at CVS, for example. That's the kind of thing I want to see, because not everybody can go and spark up a fat J of K2, especially if somebody's an Alzheimer's patient, for example, or there's tons of reasons for that.
Without getting too far down the rabbit hole, what are some of those gaping flaws in that in the current system that you talk about?
Sure. Yeah. I mean, especially the regulatory system. And I think we're seeing it in all of the news headlines that come from cannabis regulation, that Organization A at the government tells Organization B they should reschedule cannabis, and it becomes this, huge buzz. But really, that's just one person's desk arguing with another's, somewhere in Washington. And so there's so much talk, and there's so many different organizations that are involved. I mean, what the DEA has said is in contrary to what other organizations have said, FDA, about cannabinoids and relating to the Farm Bill. And so the gaping hole, I would say, is just poor communication and an inability for certain elements of the government to sync up with one another, because they're pulled in directions and move slow and are responding to the public in some cases, but more often than not, it's political motivation. And so there's just a poor communication and poor efficiency as to how cannabis is being handled at the federal level. And it's going to take a lot, I think, considerable more time before it gets worked out. But in the meantime, it is possible to work within the system. And actually, if you work with cannabinoids, it's actually kind of a good time right now because of what the Farm Bill and allows via any derivations from hemp. I mean, you can take hemp, extract CBD, and do tons of chemistry on that CBD, and you're all still considered hemp.
So is that part of what drew you to FloraWorks, is to kind of how far down the path the company already was in terms of cannabinol or CBN, and the study that they conducted for its effects for sleep? Yeah.
So that sleep study was kind of started before I arrived. So I've been consulting for FloraWorks for a year or so before I came on as VP of strategy. So that sleep study that you're referring to, which I'm glad you brought up because I'd like to talk about, had just been initiated by the time that I started working with them. So I got to see that roll out. And so no, the answer was no, it wasn't where they were. In fact, there were other companies that were considerably further along in terms of drug development, or just as a company in general, that, were of interest to me. But it's all about the people at FloraWorks. I mean, I had spent, like I said, before going on board formally, a year working with particularly 3 individuals at FloraWorks, who are the CEO and 2 of their chemists, who are just stellar people. And so, that was really what was my driving force for joining FloraWorks. But since you brought it up, I'd like to talk about the sleep study.
Yeah.
Yeah, so FloraWorks is the first, as far as we're aware, at least the first people to run a double-blinded, placebo-controlled clinical study of CBN for sleep. And this is CBN in the absence of anything else. It's not like a combination with CBD or THC. And this is also against melatonin. And so this is a decentralized trial, which is a cool new way of doing clinical trials that sort of come about more post COVID, which is that instead of having all the people come to a specific location and have them be studied there under the influence of whatever compound you're going to give them, the compounds are sent to people and they're surveyed on their phones. We worked with a great company called Radical Science that does this kind of decentralized study. And although this isn't sufficient for a FDA pharmaceutical drug, this type of work is sufficient for this type of trial is sufficient to validate a supplement. Okay, so the supplement being different than pharmaceutical, and we can get into that. But yeah, it was interesting to see the way that it's done and the kind of results that we got back, which indicated, for one, that CBN, pure CBN, in FloraWorks form, which is called True CBN, and so it's a trademarked product, and it's a specific type of purified CBN, if I can leave it that way. So it's not exactly CBN per se, but it is a highly purified form of it. And so this True CBN had shown to be effective over melatonin, clinically effective over melatonin and over placebo. And so it's an interesting and exciting time to be part of FloraWorks because of that, in part.
So what is the next step? What happens now after the study to bring True CBN kind of to a mass market?
Yeah, good question. And so the the short answer is the supplement route. Okay, and so you can actually buy samples of True CBN straight from FloraWorks website if you're interested in trying it. But what we would like to do is get that, into Kroger's and CVS's and on the end caps there. So that we can, see that. And so what we are doing is the required toxicology work, and other studies that are required by the supplement system for us to be able to put something out at that level, as well as to be able to produce the amounts that we need to produce, which we're doing in partnership with some other folks.
Okay. Another part of the industry that I'm really curious about is tech transfer, just because I've seen in the broader manufacturing and engineering industry, tech transfer kind of go a long way in terms of bringing new ideas to market. So what are the opportunities for tech transfer in cannabis?
Oh, there are so many, and it's such a playground. I love it because there's a lot of stuff, and it's in cannabis and academia, which is kind of where I find most of it, where I have professors out there that are working on, say, cannabinoid derivatives, for example, or new uses of cannabinoids, rather studying the disease treating efficacy of cannabinoids. But they're not focused that they want to share this information with the world and are not focused on actually commercializing those things. And so that's where tech transfer comes in. It's exactly what you're talking about. And universities have tech transfer offices that I work with, and that FloraWorks works with, so that we can transfer that stuff out. And so the opportunities that I would say really lie in uses of cannabinoids, identifying and narrowing the use of them. Anything that has to do with any sort of process with the plant. I mean, the plant is a difficult thing to work with. And anybody who's worked with, extracted cannabinoids and stuff knows that it's, it's not like dealing with other purified compounds. They're difficult to crystallize. They don't dissolve in water. There's all kinds of issues that go with that. And so people have used their brains and time that they spent working on this to develop creative ways of dealing with the plant and everything that comes from it. And so I think that it's basically plant handling and methods of extracting and purifying cannabinoids, as well as the uses of them for a variety of things, everything from back pain to lubricants.
So Do you have any projects that you have your eyes on right now? And what do you look for in an academic partner? Like, how do you determine whether or not, like, not, I don't want to say legitimate versus not illegitimate, but maybe a project that has a little bit more legs in terms of commercialization?
Yeah. Good question. And so when it comes to academic collaborations, I mean I'm looking for the people that are doing the best work. And so I can do that. I can sort of gather that by reading the literature, scouring the literature, and just reaching out to individual people that I see that are working on cannabis and having some initial conversations with them. But for better or for worse at this point, because of the state of raising money in cannabis, I tend to go for the best named institutions. So the most recognizable. I mean, we're looking for interactions with those best schools, because that's those are the names that the potential investors see and get excited about and want to cut a check. And so that's part of it, but it also brings legitimacy to cannabis. And so the better the organizations and the more of the ivory tower type organizations that we have wrapped in cannabis research, it betters all of us in cannabis, because it brings legitimacy to something that we know is legit.
So there are those ivory tower organizations. Are there like specific researchers as well that if you tie their name to a study that's it's immediately put ahead of the pack?
Sometimes, and it's kind of a snowballing effect. For example, there are people who, like, for example, more established in their career, that have lots of grants from federal funding, and therefore the NIH, for example, the National Institute of Health, has already looked at this individual and verified them in all kinds of ways, 6 ways from Sunday. And so if we associate ourselves with such an individual, and for example, like FloraWorks is doing this with Dr. Pamela Maher, who's a tenured professor at the Salk Institute for Biological Studies, and has made a career studying all types of botanical compounds, including CBN, with us. And so yes, there are individuals that, well, they're really established, but then again, there's not a lot of people know names in academia, and unless you're talking about like Neil deGrasse Tyson or something like that, somebody
Gotcha.
who's something, then most people don't even know who they are. And so a lot of times it's more about associating with, oh, this is with MIT, or this is with UW-Madison or something like that.
Yeah.
So yeah.
I mean, I feel like Neil deGrasse Tyson is at that point now where he's beyond the work and would just have his own strain.
Agreed.
So one of the things that I read is that you hope to shape FloraWorks in their strategic direction. What do you look to accomplish?
Drug development.
Yeah.
I mean, I'm looking to study and commercialize individual cannabinoids that people haven't really seen or interacted with before. And so, strike out the top 6 or whatever that come to mind and go down the list. I mean, those are some of those that we're interested in. We don't focus a lot on extraction. It's more of conversions. And so everything that we've been doing lately is sort of starts with CBD and gets turned into much more effective stuff. And so, but what I'm working towards is a next generation drug development platform within FloraWorks. And so using computational technology to identify biological targets for cannabinoids and cannabinoid inspired compounds, which is what I call derivatives. And so basically let's isolate some or obtain one way or another some sort of phytocannabinoid and see if we can improve upon what it does. So first of all, establish what those individual cannabinoids do in the body, the mechanism, the proteins that they act on, or enzymes or receptors that they interact with. We identify those through computational studies, and then find somebody or use one of our existing academic collaborations to get some actual laboratory data on those type of interactions. And then we use more computational technology to say, okay, what can we do to change this phytocannabinoid, this drug molecule, in a way that is going to have more favorable interactions with these biological targets in such a way that reduces side effects or increases efficacy or decreases the dosage amount, this, that, or the other thing's desired effect, by designing these things into future drugs. and it's all based on and inspired by cannabis and cannabinoids.
So that entire process, from like an outsider, sounds incredibly expensive. Is there the same issue with capital and trying to find the resources to accomplish that? Is FloralWorks struggle with that, as we've seen kind of other operators struggle in the industry?
Yeah, I mean, across the board. I mean, so FloralWorks really is at once in the cannabis industry, but also in the biotech industry, and tending more that direction. And so you're dealing with different pools of investors and different interest level when it comes to basically, are we looking at cannabis investors or are we looking at biotech investors? And it's a different sort of way of telling the story for each kind of group. But yes, these issues with getting funding are across the board. They affect everybody. But the thing about it is that what that does is it makes those that do have the cash to invest in something really critical, because it's not like, oh, let's just cut checks for everything. It's like, all right, well, I can really only make one investment. It's better be a really good one. And actually that for FloralWorks is a great place for us to be, because we stand out because we're doing a lot of things that other companies are not willing to or not able to. And when it comes to, if you compare us to anybody working in cannabis, whereas if you compare us to the pharmaceutical industry or biotech in general, we're touching cannabinoids, which most of them have no interest in ever touching, to their loss. And so we're in a good space. So for FloralWorks, things are okay. But yes, it is generally tough out there, especially right now with the financial situation and in raising cash. And yes, you do need a lot to do these things I want to do.
So in general, how would you describe the current state of cannabinoid science?
Chaos. And it really relates back to like we're all kind of waiting for what regulators are going to say and trying to operate within this sort of jarbled situation that's going on with federal regulators and how they want to handle cannabis and cannabinoids. At the moment, as I mentioned earlier, it's kind of good, because if you do things right, then you can operate entirely under the Farm Bill. And when I say do things right, I mean do things in a way that allows you to freely operate without the stress of licensing surrounding cannabinoids and cannabis. You can operate in the cannabinoid space just under the Farm Bill, only using hemp, quote unquote, even though you're doing a lot of non-hemp stuff.
Okay. I hear a lot that there's still so much that is undiscovered, so many molecules and parts of the plant that remain undiscovered in cannabis. Is that your interpretation as well? Is there still a whole frontier out there that we haven't even scratched the surface of?
Yes. And it's to the extreme. I mean, you always see these papers, I mean, everywhere from academic publications going back, I mean, literally almost 100 years now. You hear people pointing out that cannabis has so many compounds in it. And so if you think about all the cannabinoids, they're from a plant perspective, they're secondary compounds. If you look at plant biology, they're called secondary compounds because they're not required for it to live. The plants and plants make lots of compounds that they need to live. For example, chlorophyll, can't function without chlorophyll. All the cannabinoids and all the terpenes are all made by the plant as a defense, in the same way that caffeine is made by cocoa beans, and spearmint, makes certain compounds in there. It's to ward off animals. And so there's no other example out there of a plant that makes more secondary compounds than cannabis. Okay. And so we have this gift from nature, which is this crock pot full of potential drugs. And that can be accessed. And so I think I might have lost where we were going.
No. There. In terms of
I do think there is tons of options out there, and even more than people quote, because I look at the terpenes even as potential, having potential medicinal value. For example, there's a paper, an academic publication in the journal Proceedings of the National Academy of Science, which is one of the best journals out there. That's from 2008, I think it is, 2008 or 2010, which is entitled very explicitly, Beta-caryophyllene is a dietary cannabinoid, something along those lines. And I've always wondered why it's yet to have someone pick this up. And I haven't done this because I've been focused on other things. But what this paper basically shows is that beta-caryophyllene, which is one of the top terpenes that you'll find in any cannabis strain, when isolated and studied, showed that it basically reduces appetite. And so again, you're back at this, kind of full circle with the drug design, back to appetite reduction. And here's something that's considered just a flavor and a fragrance, and it's actually might as well be as powerful medicinally as THC or CBD or any of these other compounds in the right context. And so, in addition to all the cannabinoids that one could potentially extract therapeutic value, there's also potentially all the terpenes.
With your pedigree, you could pretty much go into any industry, or you could go anywhere you want. Do you foresee yourself staying in cannabis?
Yes. I mean, I would say expanding that out to psychedelics as well. I've always been interested in psychedelics. The interactions between psychedelic compounds and the receptors involved is very, very similar to what's happening with cannabis and cannabinoids and cannabinoid receptors. It's all the same from my perspective, and something I'm equally interested in. So yes to cannabis, add psychedelics.
Okay. Based on where the cannabis industry is now, where are we from a psychedelic perspective? Because I feel like cannabis is getting a lot of the headlines, and psychedelics, like almost underneath the surface, is kind of moving faster than the cannabis industry.
Yes, yeah, that your perception there is spot on from what I'm seeing from the sort of scientific and patent perspective. If I go out and look at basically how many patents have been filed in the past year or two in the world of psychedelics, it's way, way more than in cannabis, which is weird because there's a lot more people working in cannabis, and there's a lot more compounds that are cannabinoids that could be studied. And so it goes back to what I was saying, is that there's hesitation among the cannabis community to do that for a variety of reasons. Whereas from my experience working in psychedelics, there a lot more of those that are working in psychedelics came from healthcare or from some sort of more medically oriented background rather than from cannabis. Okay, and cannabis is of course medical, but it's just a whole different world. And so what I see is a lot more people, a lot more, pedigreed, if you will, to use your terminology, professionals working in psychedelics than in cannabis. And so I think as a result, that's making the business and some elements of the science move faster than cannabis. And so to exactly your point, that's what I see going on as well. And I think the reason for it is for one, it's the some of the people involved, but also some of the regulations around it. I mean, there's no psychedelics that, I mean, I guess LSD, but the scheduling, the whole Schedule 1, Schedule 2, Schedule 3 is a little easier in the psychedelics world. There's also, you're treating, there's less of the stigma is different. People associate psychedelics with all this color changing and stuff like that. And, you can think of your various video reels that associate with what a psychedelic is. But outside of that, it just doesn't have such negative connotations as cannabis does. And so I feel like it's a little bit less of an uphill battle if you're going to work in psychedelic science rather than cannabis science.
Okay. Yeah, I guess there wasn't like a psychedelic madness equivalent.
Exactly. Exactly. It's all just viewed as mind expanding and something that, elites and intellectuals are into.
Well, thank you very much for being generous with your time. I really do appreciate your perspective. Been a very engaging conversation. But before we get out of here, I just want to make sure, is there anything else that you want to make sure the Cannabis Equipment News audience knows, either about yourself or your work at FloraWorks?
Yeah, I would just say that if you're interested in talking with myself or any of the folks at FloraWorks, you should reach out. I mean, it's like I said, we're a great group, open to chatting and looking to collaborate on certain things. And so, but yeah, pay attention to FloraWorks. We got a lot of big stuff in the pipeline, and so keep us on the news alert.
Well, I will certainly be watching, and please keep in contact so that way we can watch the company evolve.
Definitely. And great talking with you today, David.
Excellent. Well, before we get out of here, please make sure to like, share, and subscribe to the podcast. You could also help us out a lot by leaving the podcast a positive review on whatever platform you use. If you want to email the podcast, you can reach me at david@cannabisequipmentnews.com with email the podcast in the subject line. You can also subscribe to our daily newsletter. Make sure you get it delivered to your inbox first. For Dr. Mike McCormick, VP of Strategy at FloraWorks, I'm David Manti. This is the Cannabis Equipment News Podcast. We'll see you next week.
Thank you for listening to the Cannabis Equipment News Podcast.